Hi there, everybody. This is Dr. Buckley with the Doctor Driven Referral System, and welcome to Module 2. This is where we're going to figure out and help you start the process of creating this reputation in your community about that you are the go-to person when it comes to referrals. So, how do we start? Well, first and foremost, what you want to do is you want to ask every new client if you could send a report to their healthcare provider, and you're going to be letting their healthcare provider know that you are providing massage services for them. So to start it off, just make it a process that every new client that comes in, you're going to start this process with. Okay? So what you're going to do is you're going to gather up the names of these primary care healthcare providers. Start off with their family doctor or their internist, their primary treating physician, and create a database of who they are. I do it very simply into a Word document so I can just copy and paste into a letter, but you could do it by using a spreadsheet. You can do it by using some type of database program. The key here is to get the names and addresses of these providers. Also, if you can look it up and find out what their phone number is and what their fax number is, you will be able to use this later very effectively to get the reports out on a timely measure. So you basically get the names of who these primary care providers are. Okay, so depending on the client, you're going to be using a template letter to put in the patient's name and the provider's name and address and fill in the areas of customization. We'll be talking about these letters in a later module, but there are template letters that are already set up. All you have to do is populate them with the information and you have your letter. Then you need to mail your letter to the provider, and you also need to provide a copy to your client. Now, you can hand it to them when they come in, or you can mail it to them. I'd mail it to them because it makes it more official. Also, one of the things that you want to do is make sure that you do this immediately, because timing is essential. Then you're going to be putting these letters, a copy of these letters, into a tickler file that we'll be talking about later, about how to do it, but this is for your records about keeping track of the letters you send out and also who you're contacting with. So it's a very simple process, and I'll just rephrase it now. A new client comes in, and you do your intake, and one of your questions you ask is, may I notify your primary care provider that I am providing massage services for them? I have been asking medical doctors, asking patients for the last 20 years if I can send their doctor a report that they're seeing me, and not one person has ever said no. The question they may ask is, why? The easy answer is, to help coordinate care, providers need to work together to let them know what we're all doing so that we can best plan out how to best take care of you. So if a provider knows that you're getting some other type of service, they can ask about that and figure out, is it helping, or is it contraindicated, or is it synergizing with what they're already doing? So basically, it's this good communication between healthcare providers in the best interest of the patient. People love this. They love it that you as a massage therapist are communicating with their doctors or whoever's on their healthcare team. They love this. So as you ask them to do that, they give you they're okay. What you then want to do is, after you see the client, you immediately want to write out a report, fill out the letter. There's the templates I'll talk about later that you'll be able to fill out, and send a copy of that letter to your client to let them know that you sent this letter to their healthcare provider. There's a couple reasons to do this. One of them is that A, you followed up with what you said you were going to do. Two, they know that a letter was sent to their primary care doctor, so if they ever see the doctor in the near future or for regular checkups, they can ask the doctor, hey, did you get the report from my massage therapist? Or the doctor may say, so you're seeing a massage therapist, how's that working out? This is called the coordination of care. It's just a better understanding. And guess what? When all your providers know what's going on, it makes for a really wonderful relationship. And it also really paints a great picture of you in the process about how professional you are and also about how much you care. So one of the things is that medical doctors, this is how they operate on a regular basis. They refer their patients to other providers. That provider will see the patient and then send them back a report to let them know what happened. Because unfortunately, patients are poor vehicles for transporting information back and forth between providers. So when this happens, where a doctor gets a report from the other provider, they know what's going on. Nothing is lost in translation. In fact, it's done much more effectively and efficiently. And you will now be part of this team. And when you do this, it will provide a reputation. People will look at you in a different way, in a very much a professional way, because no one else is doing this except for you. So you're going to be sending that letter to the doctor. You're going to be sending the letter to your patient. And you'll also be keeping a copy of the letter, and you'll be putting it in a tickler file. And we'll talk about this later. But tickler file has been around forever. And I'm sure there's electronic ways to do this, but there's something magical that happens when you actually have a piece of paper with the letter with a person's name on it. You're putting it into a tickler file for future reference and timing, and you go through and you look at those names, you look at the dates. It creates a innate telepathic communication with these people, that you're thinking about them, and also that you'll do the proper follow-ups that will teach you in one of the later modules. And one of the things that's really important is timing is everything in this. The day after or within 24 hours of seeing that client, you need to get the letter out to everybody. That one, shows that you're on top of things. Two, it creates this perception by everybody that you're on the ball and that you can be trusted, that you're acting in a very professional manner. One thing also that you may want to do, and what I mentioned earlier, is get the fax number. What I do is not only mail the letter to the primary treating physician or the doctor, I also fax it over to their office so that they get it, and on the bottom it says hard copy will follow. So a lot of times you want some impact. You want this to jump out at people and get them to pay attention to, wow, this is something different, never seen this before. A massage therapist sending me a report, or a chiropractor getting a report from the massage therapist, or whatever, as you will teach later. You can span this out. The timing is everything, but the impact will be incredible. You will be memorable and stick out in the person's mind, especially if you do it on a regular basis. And we'll show you how to do that in module number 3. So module 2 is about how to get started, start getting the names, start sending the reports out, use the templates, use the tickler file, and in module 3 we'll show you how to follow up.